Kiriana promised she'd put the mics down low enough for us short old people. She didn't get quite low enough. Good morning, and thank you for this opportunity to explain why we haven't got the answers yet. But more than that, I want to take the opportunity really just to reiterate some of the messages from the report. You'll be pleased to know that I'm not going to go through the 302 pages because I know that all of you will have already been through them all, so we don't need to. It's been interesting since we put the report out. I think the most common response to us, well, the one that was actually given to us, so the polite one, was that it was a good read and that it told people everything they already knew. So I thought, well, that's good. I wonder why it took us so long to write, really. But my response to that is it meant to me that either all the people I spoke to had only read their chapter, which I suspect was the most common response, and so therefore they thought they knew it all, or they had read that bit, started another bit and given up, or they really did read it all and knew it all already, and I wondered why they weren't already on the panel. But whichever one of those categories you fit into, the question that arose for me is, if we did already know that, and I absolutely accept that there was nothing in that report that somebody in the system had not talked to us about, right? We didn't make any of that up. What we did do is we listened to everybody around the system. We then did a bit of checking, because sometimes, believe it or not, sometimes people believe things which aren't actually true. And there are quite a few times in the health system that we get told about how the system works, or why something doesn't happen one way because of some rule that somebody made. And when I go to look for that rule, it's not actually there. And so we did a bit of checking to try and actually clarify some of those points about, right? And I'm still trying to work out, because I have been around every DHB apart from Capital Coast, but never mind. I visit that on a regular basis, so it's okay. Every DHB told me, with a straight face, that they were unfairly penalised by the population-based funding formula. So, Capital Coast Health, you must be getting a hell of a big share of it, because everybody else is not, according to them. And I did a maths degree a long time ago, so I'm looking back through my notes to work out how everybody can be so far below the average. Haven't worked it out yet, but that's why we haven't finished the report. But I suppose the other thing about the report is that accepting that there is nothing in there that is new, what I think is new, and what I think the panel has done well, is put it all in one place. And that is what we do not do well, or have not been doing well, in my view, in the system. So our real message from that report is that if we want to change the system, if we want to make the system more equitable, if we want to make it more effective, if we want to make it more sustainable, we cannot do that by changing only one part of it. And it doesn't matter which part you are passionate about, you cannot fix that part all on its own. And so the problems we have, I believe, in the system is not because of ill will of any part of the system. It's not just because this part of the system doesn't talk to that part of the system. It's that we treat the parts of the system as independent bits and we focus too much on those. But it also tells us that if we want to fix the sorts of parts of the system that worry us most, i.e., why is it that Maori life expectancy is so much worse than Pākehā life expectancy? Why is it that people with disabilities have worse health outcomes? Why is it that Pacific people don't feel able to access the system, right? All sorts of issues. If we're going to address those problems, the message we are trying to give you from the report is that we need to start with some of the fundamental issues in the system. So, to fix Pacific health or Māori health, we have to start with also fixing things like data. If we don't bother to collect the information that tells us what is happening in the system, it is not surprising that we don't address the problem. And the system has been horrible at ensuring as a system, not as one little part of it, but as a system, we have collected the appropriate data and we have used the appropriate data. You can all tell me about lots of examples of where you've got wonderful data sets or that or wherever, or you know how that, and we heard yesterday about the improvements coming from healthcare homes because they were actually managing the data. But it's not moving right through the system. So the question now is not what is wrong with the system. We've tried to lay that out. We've reflected back to you what you've told us is not working as well as it could within the system. And let me remind you that the report also says, and we need to be proud of this, we do have a good health system. We have one of the best health systems in the world. Doesn't mean it hasn't got problems, but it does mean that we shouldn't knock it too much, right? It provides a lot of good health care for a lot of people. Just not all the same everywhere, which is not so good. But I would also say that most of the answers are also already in the system somewhere, right? So don't hold your breath waiting for this panel to come up with a system design which you've never seen anywhere, right? We've talked about good examples already yesterday, right? And people are really proud of things which are going on in their DHB or in their practice or in their community. The challenge for the system is how do we ensure that those good things that have been tried out and work in one place actually get translated into things which improve the whole system. So, which is partly why one of the biggest sort of directions of change that we talk about is the need to make the system operate as a system instead of operating as 20 different systems. Because at the moment, that's probably the biggest barrier to actually it moving on. Hence, we get a system which to the public looks a whole lot more complicated than it needs to. As we say in the report, health systems will always be complex. They don't have to be as complicated as the one that we make. And again, you know, why did it take us 302 pages? Was it really? Because there's a lot of moving parts. And so we have to try and get it more simple. I'm not going to go on any more about where we think we're going yet because the panel is all going to respond to the questions. Let me just say, though, that to reiterate that I think the message and the challenge I put out to each of you in the next few months as we keep coming back asking you more questions is to really focus on thinking about, okay, we do understand the problem, but we've known about these problems for a long time. So what is it that has stopped us solving the problem before, right? And as I've said to many of you and things, it can't be just because that other person doesn't do things right. So what can each part of the system do, and how can it work better with other parts of the system in order to move the system forward? I would tell you the answers to all that, but that would remove the excitement, and anyway, I haven't got them worked out yet. So the panel is going to give you some indication of where the thinking is going. We've tried to give you that indication in the report anyway. but don't expect the answer yet. Thank you.